We have Dr. Nancy Bryan. Nancy has so many wonderful accolades behind her. I believe a BS in biochemistry, a BS in pharmacy, doctor of pharmacy, nutrigenomics educator, certified diabetic educator, certified geriatric specialist, medicinal, nutritional, and veterinary formulator. So if you're wondering about, why she's in LifeVantage, what she thinks, please take it away and tell us your story.
Oh, it's such a pleasure. Thank you so much for inviting me. I hope you can hear me well. I am just honored beyond belief to be able to be on any team that ever is willing to share information. First of all, I want to say that a lot of people across the United States, across the world now, I mean, we're such an international company now, it's awesome. All ask me the same question all the time. With all the other things that you do, you certainly don't need to do this. So why are you doing this? And I like to get right to a simple answer first, and that is I feel a moral obligation. The reason that I feel that I have a moral obligation stems from two things. The first thing it stems from is my own personal testimony of what happened for myself. I was a breast cancer survivor and doing actually fairly well. I was on a medication called Arimidex, which is for breast cancer that's very estrogen positive in tumor formations. And I was doing okay, but I found out I had a gene that really makes my body very incapable of really stopping cancer cells. As a result of that, many people in my families, I think it was 7 people that died in my family that are close relatives. One was my sister who died of leukemia at 21, and another was my uncle and his 2 children. And the bottom line is we have a problem with a gene defect where we only have 1 survival gene out of 2 in every cell. That means that I can have any kind of cancer. And so after I got through all my chemo, radiation, surgeries and all that, I ended up with a melanoma. And I was just devastated because I was the healthiest person that I knew. And it was devastating for my friends too, because I was always the person that took lots of things, antioxidants, worked out, did all the things I was supposed to, and yet this happened. And so fast forward 5 years into it, I was still getting cut and burned all over the place for skin cancers. And I looked at a bunch of research and found the LSU study that many of you are familiar with. That LSU study was about a melanoma and the ability for a product to have a really huge effect on melanoma. And when I saw that study and I saw a product by trade name, it really piqued my curiosity. I got started on it, and as a result of it, fast forward now, I'm going into my 4th year. I have just befuddled my oncologist and all my groups of physicians that have been helpful in keeping me moving forward with my health. And my blood work is absolutely perfect. So while we can't say we treat, mitigate, or cure, all I can tell you is that I'm the healthiest I've been in a very long time. And that's what I was looking for. I was looking for my own body's ability to be able to do that again. And that's what we're talking about today. So the second reason that I became part of this company was because after I found what it did for me, as well as many other people, I took a look at the formulating side of things. I took a look at the manufacturing side of things. That's my world. I do a lot of things on my own. I make things for other companies. And when I saw the process that went into how we make our products and what we do, it was a gold standard. It was above and beyond anything I had seen in this kind of world. And so because of that, those 2 things are the main reason that I really have become very passionate about sharing this information, and just so grateful to be here and to really give people hope again.
Wow. Oh my gosh. That's incredible. I did not know all of that. I've just seen it from afar and know a little bit, but I didn't realize all of that. So even though we cannot cure, treat, or mitigate, you really shared a lot there. I have a question about, go back to why are we different in the manufacturing and the gold standard? Because you said you do a lot of this. You've been in formulation before. Why are we different?
Well, first of all, part of the reason that most studies are done with ingredients versus the actual trade name of a product, and that's on the chemical side of things for a prescription, or on the natural side of things with plants, is because they're studying those things individually. What we have is a synergy of 5 active ingredients. And the part that was really, really, stuck out to me was 2 things. First of all, this product in the studies that I saw had synergy, creating a pathway and doing something nothing else has been proven to do, especially at the level that it is. And that's to take care of a big problem we have, reducing oxidative stress. To be able to do that by 40% in 30 days and have the FDA make the statement that we can state that was huge. But the second thing is, on the formulating side, how you can make something the exact same way every single time is the important part. And what we do is we actually send out people to the source. They review and take a look at the sources of those plants themselves. They don't take the word of the people doing the quality controls. They do the quality controls themselves, and many of the lots that were given, we choose not to take, and we send them and give them to other people. We let other people take them because they don't fit our standards. They aren't hitting the activity levels that we need to be able to hit. They're not hitting the purity levels we need to hit. And so we do all of that first at the source. Then we bring back each of those ingredients back to the states. We redo that same activity level again, and they can do that through methods like chromatography and to be able to see the actual activity of that plant source. And then we make the product, and then when we're all finished with the product, we not only test it ourselves, but then we send it out to others for independent testing. And there's really no one that does that excessive testing, but we have to, because if I'm taking diabetic patients and helping them to reduce their medications, sometimes many times getting off their medications, I need to know that that product is the exact same product every single time. It can't vary. And that's a big problem with natural products. And it's a big problem the FDA has and doctors have a lot of times with supplements, because you never know if there's a little tiny amount of active ingredient or a great big amount, and it varies with what's going to happen in the body. That's what makes this so significantly different.
Wow.
So
most people have no idea. I'll tell you, our Dr. Chevreau is a genius. You have no idea what she goes through to make sure of what we have. And the proof is in the pudding. When the Federal Trade Commission came and took a look at what we do, they are the ones that told us we were the gold standard. And they are the ones that commended our president, Darren Jensen, on a great job. And they've actually asked him to be part of some of the processes that are going to be going through to tighten the regulations.
Wow. I knew we had a great process. I just did not know in depth. So I really appreciate that. Shannon?
Yes, and I'm excited to hear that about your comment about Darren. So that's really exciting. More kudos for our company. Nancy, because we sometimes use these to send out to prospects, and we have newer people on that listen to our Zooms. Can you share, because of your vast knowledge, compare Nerve2 activation versus a supplement?
Oh, yes, that's so important. And I myself had been on many supplements and antioxidants prior to my cancer. What I wasn't doing was activating my own body's antioxidants. This is about internal antioxidants that we produce ourselves versus external antioxidants. It doesn't mean you don't eat fruits and eat well, and it doesn't mean that you don't take your minerals like calcium and magnesium and zinc. Those are all necessary to do what our cell needs. But what we have is Nerve2 activation, which is a pathway in our nucleus. And what that pathway is the master regulator in our cells, dealing with inflammation, dealing with fibrolytic formation, and dealing with cytoprotectiveness, which is our cancer protection. And so that pathway, that NRF2 pathway, is the main thing that our flagship product is about. That's our NRF2 synergizer. Our NRF1 has to do with mitochondrial repair. And what we found is when the cell is busy doing the things it's supposed to do, it also requires the energy to get the work done. And so that's why we call it our 1-2 punch. The NRF1 is going to help to not only repair mitochondria, but also increase the production of them. And as we age, we lose those. We also lose our NRF2 pathway function. It just is part of aging. And so all we're doing is helping our body to activate that again from the inside. And it's millions of times more powerful than being able to take a supplement on the outside. Having said that, I also caution people, if you're taking high amounts of vitamin C, if you're taking high amounts of turmeric or some of those other things, you're not going to get the same type of synergy that you have with these 5 ingredients. And as a result of it, you can definitely interfere with this pathway as well, because that tiny little minute amounts is more of a homeopathic thought process of using subtherapeutic amounts of 5 ingredients to turn on our own body's ability to do something, versus taking massive doses of things to clean our liver or to do other enzymatic equations. And so I caution people that if you're on a lot of those other things and you really want the best benefit from our NRF2 and our NRF1, and from also our Omega and ProBio, it's best if you're not taking other supplementation aside from possible calcium, magnesium, and some of those types of things. Okay?
Got it. Okay. So talk about that for just a second, because we do have what we call the core 4, the Omega and the probiotic. I know you love our probiotic, and I've heard you talk about it a lot. So is there something that you particular that you can give to all of us, that why is it so different?
Well, first of all, what I liked, and long before we had our ProBio finished, I would, when I did my talks, talk about those 4 pillars of health. The oxidative stress being removed, we need that trash out, we need mitochondrial health, but gut health is where it all starts. If you don't have your gut health, you can't absorb some of these other nutrients properly. And so what separates the ProBio that we have versus many others, and there are some others out there that are pretty good, but what separates us from a good portion of the ones out there that are not that good is the fact that we're going to be getting 60 to 70% of the probiotic that we have in this product through the stomach acid due to the technology. BioTrack technology puts us leaps and bounds ahead, because most probiotics come in the form of a capsule. Well, that capsule is going to wick away a lot of moisture and start activating those probiotics. So by the time it actually gets into your gut, you're only absorbing about 4%. Well, I like 60 to 70, way better than 4. And it's pH activated, so the right probiotic goes to the right place in our digestive tract along those pH points. And we're going to actually develop a biome, an actual home for that probio where it can actually work properly. And then last, we have Wellmune, which is a patented product from someone else that partnered with us. And I'm so grateful, because what it does is it really boosts our own immune system, but not in an overabundance. So for instance, we're going to help take out the proper trash from the digestive tract that needs to go, and not be too stimulated to affect other things like make inflammation in a cell. That's really important, because that's what happens a lot of times when you have overstimulation of an immune system. So together, you're going to see a much better absorption. And then we really needed to know that we have an omega that's a clean source. And so the omega that we have, the important thing is getting back to our 4-to-1 ratio with our omegas, with our 3-to-6 ratio. If you don't have that proper ratio, you don't make other things that you need to, and you don't operate other paths that you need to and utilize our omegas properly. That's why we have to have it in the proper ratio. That's what using really clean fish will do for you. So it comes from Nordic deep sea waters straight to our boat. And I love that you can actually go on our site and you can track from our, whatever bottle you have, you can put in the lot number and you can track it straight back to the boat when it was pulled out and everything. It's awesome. The other thing is we have wild salmon from Alaska for the omega-7s, and the omega-7s are super important because we aren't producing and making enough of those based on the wrong ratio from all of preservatives. There's so many other things that skew us and give us way too many sixes. And so together, you've got those 4 pillars. You've got the NRF2 pathway operating, so you have oxidative stress reduced. You have the mitochondrial repair and production so that you're now getting proper energy to the cell to do the work it needs to. You're getting probiotics that are proper, so you're getting gut integrity and absorbing everything. And the omegas actually go through and help with connectivity in our brain. We always hear about fish food and being brain food. They also protect every cell. And that goes everything from our digestive tract all the way through our body. It's like a protection. We need that, just like when you put lotion on your hand to make your skin more supple. Those omegas do that on the inside and really help our cells to be more supple and protected.
Oh my gosh. You're a plethora of information. I'm just like, we're getting text messages right and left, just so you know. Like, everybody's like, this is amazing. Thank you so much. So Shannon, I know you have a couple of questions.
Yeah. Can I go? Can I jump in?
Yes.
So Nancy, I know, Nancy, so you were intrigued with what we had. You were loving the products. Talk to us why you jumped into the business, and what your vision was for that.
Well, I think the most frustrating part for me was knowing where our medical system was coming from and being a pharmacist as well. I'm licensed in several states. My background that I didn't go into a lot started long ago working in long-term care, taking lots and lots of people off medications as they came into long-term care. They were all on multiple pharmaceuticals because each of the different doctors never knew who was on what. And we've gotten better with that. We have a better communication between our specialists and our primary care doctors now, but people are still on way too many medications. And as a result of it, what we see is so many side effects. And so for me personally, my goal is to be able to help educate enough people, especially in the medical field, because I want them to be able to take a look at this information, because once they start seeing the true science behind this, it's going to be a benefit to our medical system in general, just like we saw the Washington State University study. Basically, the conclusion they had of the NRF2 pathway is that it's going to be the greatest therapeutic and preventative breakthrough in medicine. They didn't say this century, this decade, this year. They said ever. And for me personally, this is what medicine has been looking for, what we've been striving for since the beginning of time. This is really a blend of taking Eastern medicine and Western medicine and helping all of us work together toward wellness, because the pharmaceuticals, while we need them at many times to get control of our body enough so that we can look for other options, we need to have other options. And those other options can give us hope that we don't have to stay on those medications, and in many cases, not have to go on them to begin with. And that was really, for me, I know that seems like a really big, big goal, but it's happening, because in the last few years, I did not make a lot of headway initially with a lot of my peers. And in the last 6 to 8 months, we are seeing a massive change in thought process. We are seeing integrative medicine. We are seeing alternative is not being used anymore as terminology. What we're looking for is functional medicine. We want the body to function. And when we need prescriptions, we need them to get control of our bodies. But the whole purpose here is to be on as few of them as possible, because we all learned in chemistry early on, we need a balanced equation. We need the equations going back and forth to balance. When we use pharmaceuticals and in some cases supplements, we don't get a balance. When we're talking about this NRF2 pathway, what's unique about our product is its ability to be a pulsatile action. It acts like a thermostat, and the body's biofeedback is what allows all those things to start righting the ship. And that ultimately for me is the information I need to get out to the medical community, and we are making headway, and I'm so grateful to be able to be part of the team that does that.
Oh gosh. Okay. So you said from the last 6 to 8 months, there's been several, we're seeing that switch, which we've known that switch was going to happen, but now it's just now coming aboard. So the science proceeded, now medicine is coming alongside. Right.
And the business. Yeah. And that makes the business super exciting to be able to be part of that. Of course, I want to be part of a business that's successful. And yes, my dream is to help make our medical system better and to make people well. But you know what? To be able to be part of something huge like this right at this moment, it's super exciting. We all get maybe 1 or 2 chances in our life to be able to be part of something that is going to become so huge. And that's the part that I'm so excited. And that's why I think we're seeing more and more. I mean, I'm having doctors come on board now, and I was not making any headway with them early on. And now they are seeing where it's going for 2 reasons. A, they have golden handcuffs on. They're making money. They have no freedom. And yet at the same time, they are caught between a rock and a hard place where they're not seeing their patients have the kind of wellness they want them to have. And so this gives them an opportunity to be able to have the freedom. And we have several doctors, those of which you know, that are retiring from their practices or selling their practices and moving forward, because ultimately we're able to change more lives this way and to be part of a business that's super exciting.
Wow. So, okay. So this is my caveat, or this is my take on that, is that, and I know Shannon's going to have some other questions, but because of that switch, are they having a hard time thinking about this as network marketing? Or is this that, well, it is what it is?
I think everyone has that difficult jump. I know I did. I grew up in the backyard of Amway. And when I tell you I grew up in the backyard of Amway, I mean really in the backyard of the Amway. My husband and I had our wedding reception at the Amway Grand Hotel in Grand Rapids, Michigan. Everyone I knew was in Amway at some point in their life. I didn't want anything to do with network marketing, but now I have a completely different understanding of it. And really, truly, when it's operated properly and when you have the company in conjunction with the field, it is a super exciting way to market a product because you're able to get to the masses. And the other thing is it allows everybody to benefit from it instead of paying all the marketing people on television for commercials, or instead of paying, big organizations, they're able to pay the little people. And it's everything from people just being able to afford their own products, which is a huge thing. We want people to take this, to making enough maybe to help with some of the bills at their house. And I think more and more of them are starting to see the value of that. And it gives them the chance to know that they have the opportunity to not have to be in their practices. And I think that goes and holds true for many of the people I'm talking with, be it a doctor, be it a pharmacy technician, or, being a preschool teacher. It doesn't matter. It's the options that they have to be able to have a backup plan. And that's what we all have to have. We have to have that security.
That's so true. And what seems just so incredible to me is that everyone is in so need of that backup plan. It's not have the security of a job.
Not at all.
Forever. So, backing up a little bit to the beginning of when we were talking about products. Can you talk with us about our weight management system, about the physique system, and with your background, what you like about our weight management, how it differs?
Oh my gosh, I tell you, I almost hate to get started on it because I could do a whole hour talk just on our fat burn. It's so exciting. One of the first things when I first heard that Dr. Chevreau was coming out with fat burn, I just made my eyebrows like pop way up, because when you're a pharmacist, one of the biggest struggles you have is people coming in, they want to lose weight, they need to lose weight, yet most of them have blood pressure and sugar problems. And then the first thing they want to do is when they're taking any of these types of products, that is a real problem, and it creates a lot of problems with blood pressure and kidneys and diabetes, and so they can't take them, and it's a vicious circle. And so when I first heard about this product, my first questions were, okay, is this going to be safe for the people that really need it? And what I'm here to tell you is the most exciting thing. You saw as part of my title, I'm a certified diabetic educator. I deal with a lot of diabetes. And the number one issue that we have in our country right now is obesity and diabetes because our guts are not fixed. And so what I love about our physique system is it's about fixing the gut. And then that fat burn, what it does, back to those equations that have to flow the right ways, we have pathways that go to the pancreas and from the pancreas that signal what happens with our sugars. It also goes to our fat cells and back to our stomach, and also from, sorry about that, I got a call there. I got rid of it. My fault. But what I did want to explain is the liver also is very involved. So those 6 highways I talk a lot about, they have to go both ways all the time, and they get clogged up. So you have a freeway going one direction and a dirt road coming the other, and what happens is our insulin stops working so well. So we're producing insulin, but it doesn't work, and it's called insulin insensitivity. What our fat burn product does, it has 2 things in it. It has something called svedtol and sinotrol. Those 2 products work together to make our fat burn for energy and to wake up our pancreas and have our insulin talking back to our gut so that we have a communication and glucose being utilized again. And as a result of it, we see many of our diabetic patients do extremely well on this. But more importantly, we see so many people that have fat around their visceral organs from lots of different reasons have great success because their body's communicating again, and those enzyme pathways going back and forth are going to operate like freeways in both directions again. And that's what's so unique about the fat burn. Also, I always recommend the cleanse for anybody, even if they're starting Vitality Stack. Start with a cleanse. It's a simple, easy cleanse. It's going to ensure that our pathways are opened up and that we get the gunk out of our digestive tract, and it's simple. So that is a big part of it. And then we have our protein shake. And the reason for the protein shake, we just want to instill enough protein in there so that we aren't burning up muscle. We want to keep our muscle integrity. So that's the important part of our physique line. It's very balanced. And again, it's like our 4 pillars of wellness. It's the same concept of cleansing and making our gut stable, and then having those pathways operate properly, and then having proper nutrition.
I love how you and Patty are referring to the 4 pillars. And for everybody, I'm such a visual person. It's like a chair or a table. You need all 4 legs to be stable.